Welcome to a special edition of the Economic War Room. Our focus today is COVID-19. It's also known as the coronavirus. Now, I've been studying this problem and spoken with health and national security and business experts over the past 2 weeks. And my effort today will to bring you an in-depth understanding, the kind of understanding that I think we've been gathering in the Economic War Room. We're not going to give you medical advice. We're not going to give you investment advice. But we're going to share insights and perceptions from the highest levels. We're talking people who've gone into the White House and are talking at the highest levels in our government and around the world. Now, as we go through this, I want you to remember 2 Timothy 1:7. It's a Bible verse. It says, "For God has not given us a spirit of fear, but of power and love and a sound mind." Now, as we deal with this crisis, we're all going to need a sound mind. So that's something good that we can pray for. I'd love to introduce you to all of the experts that I've spoken with and the ones that keep coming in and out of the Economic War Room. But they're so focused on dealing with this crisis that I had to step out to give you a recap. We're going to talk about 4 areas. We're going to talk about the nature of the threat. We're going to talk about the potential impacts of the threat, what we as a nation should do about it, and what you might consider doing to prepare and protect your family. Now first, let's start with the nature of the threat. I know you've probably heard the term coronavirus, but I want you to understand this is a novel coronavirus. And when you hear that, you need to know that that doesn't mean it's written in some fiction book. This is novel, meaning new. But it's not dissimilar to a cold in so many ways. So I want to read to you from the CDC, Center for Disease Control website, what they say the symptoms are for a common human coronavirus. They say runny nose, sore throat, headache, fever, cough, a general feeling of being unwell. That sounds kind of like a bad cold, doesn't it? They also say that human coronaviruses can sometimes cause lower respiratory tract illnesses, such as pneumonia or bronchitis, and they say it's more common in people with cardiopulmonary disease, people with weakened immune systems, infants, and older adults. Now that is a common coronavirus, but this one is novel. And because it's novel, it means that no one on planet Earth has developed an immunity to it, except for the few who've been exposed to it. Now the concern is that this started in Wuhan, China. And the claim initially was that it started in a wet market or a fish or meat market. But there's a lot of evidence that it may have started in a biolab. We don't know for certain, but several people, including a U.S. senator, has questioned whether or not this was originally developed as a bioweapon. And then there are even reports that that very biolab, which is just a few miles from the wet market, that biolab may have taken animals they were testing and as practice sold them to the meat market that people ate, and then that's how it got out into the world. Now I want you to understand something else. The disease was not contained by China. We would have hoped that they would have stopped it and contained it. But in fact, there's evidence that the Chinese Communist Party actually hid information about the virus, and that prevented a better containment. Not only that, but they didn't share information readily with the rest of the world. Some other facts you need to know about this novel coronavirus, COVID-19. The death rate is estimated to be about 2%, plus or minus. Now, we don't know. We don't know because we don't have a good number of the actual cases. We do know the deaths, or at least the reported deaths. But what if China has underreported the deaths? They certainly have underreported the disease indications, so that the population that we're dividing by. But the best guess we have is it's 2% or less death rate. That means 98% of the people that get it survive. But that's still terrible. Yes, it's much lower than SARS. Remember SARS, which was another coronavirus a few years ago that also started in China? Well, SARS had a death rate approaching 10%. Well, that was bad. Fortunately, it was contained. But this is a death rate that is worse than a typical influenza rate. The average for influenza is below 0.2%. What that means that when you get a flu, The average death rate is less than 0.2%, which means that this coronavirus could be 10 times as large. Now, there's a chart here that the Centers for Disease Control put out that talks about the estimated U.S. influenza burden by season. It goes from 2010 to 2019, and it shows, for example, 2017 to 2018. I'll show you that chart right there. 45 million people got the flu, which was a big, bad flu season. 61,000 people died. Tragic. It's bad. But when you divide that out, that's less than 0.2% death rate for the flu. So when somebody tells you that this is, it's just like another common flu, yes, in some ways it is, but other ways it isn't. The death rate is higher. We hope that 45 million people don't get infected by the coronavirus. Unfortunately, that is a real risk. Now, I want you to also understand that this is age discriminate. What that means is that it doesn't affect people of all ages the same. Typically, with a cold, you see children being impacted and affected more than adults. And that's partly because kids lick their hands and touch their faces and do all kinds of things that spread disease. This doesn't seem to be impacting young people as much as it does older people. They're less likely to contract the disease, and they're much less likely to suffer bad outcomes. Now, it may be because it's underreported. It may be that children are getting it, but their immune system handles it so readily that it's not impacting them. But I want to read to you from an NPR report on February 20th. Here's the report. It says, we're seeing about 75,000 total cases at this point. You'll see that's higher. It's gone up in the past week or so. But the literature is only reporting about 100 or so pediatric cases. 100 pediatric cases out of 75,000 at the time, says Terry Lynn Stillwell, a pediatric infectious disease expert at Mott Children's Hospital at the University of Michigan. Now, I think that's significant. Only about 100 out of the 75,000. She goes on to say, it's possible that many more kids are infected but don't get sick enough to seek medical treatment. It's also possible that some infected children may develop no symptoms at all because their body's able to handle it well. So far, it appears that more than 80% of the coronavirus infections are pretty mild, no more severe than a common cold, says Cody Messner, an infectious disease expert and professor of pediatrics at Tufts University School of Medicine. And children appear to have an even milder infection than adults, Messner says. This is based on preliminary data. Now, if you look at the actual chart, the COVID-19 fatality rate, and you go by age, the death rate, I'm looking here, 0 fatalities in all the reports for anyone 0 to 9 years of age. 0.2% for 10 to 19 years old, 0.2% for 20 to 29 and 30 to 39. So if you're under 40, the actual risk appears, based on this early data, to be no more risky than the average influenza. When you get 50 to 59, it jumps up to 1.3% rate, 60 to 69, 3.6%, 70 to 79, 8%, and 80 plus years, a 14.8% death rate. Now that's pretty severe, and that's so if you're older, you need to take extra precautions with this. Now, the nature of the threat continues. I'm reading from a UK Guardian report earlier this month. This is the scary stuff. This is where we got to remember to not have a spirit of fear. They said the coronavirus could infect 60% of the global population if unchecked. That would be known as a pandemic, and a really bad pandemic. So here's a quote from that Guardian report. Public health epidemiologist says other countries should consider adopting China-style containment measures. Now, I'm going to make a comment on that. We need to do better than China did. They did not contain this effectively. And I think it's because they were unwilling to share information that would embarrass the Chinese Communist Party. We need to be more transparent than they are. But we need to do containment like they did in this respect. If this breaks out, possibly shutting schools, shutting workplaces, staying home, isolating patients for a period and so forth. I'll go on and read from the Guardian report. The coronavirus epidemic could spread to about 2/3 of the world's population if it cannot be controlled, according to Hong Kong's leading public health epidemiologist. The death rate likely 1% or less because the infection rate is underreported but that'd still be massive. And the World Health Organization says the coronavirus is a bigger threat than terrorism at the moment. So it is a serious threat, and I want to talk about it, and I want to talk about the impact it can have. So far, it's limited on the United States, but I'm going to take you to a website, and we'll put this website information in the battle plan. This is from Johns Hopkins University, and they publish it. And you can see here the total confirmed death rate, or total confirmed infection rate is 82,550, and that was as of just a few minutes ago. The total deaths, 2,810, and the total recovered, and I think this is an important point, 33,252 people have recovered. So if you go down in the lower right-hand corner of this chart, you will see mainland China. That is the yellow trend, and it's leveling off in mainland China. The green line represents, and that's an important one, the recovery rate. And then the yellow line underneath it, at the very bottom, that's the infections outside of China. So hopefully, we're hoping that this is going to be contained. I'll tell you, governments around the world are on it. I've talked to people in Korea and the United States and other locations, and they are working hard on this. Now, I want you to see the total confirmed right here. Most of it, 78,497 is mainland China, 1,766 in South Korea. As you get outside of China and Korea, all others, 705 and others outside there, 528 Italy, so I guess that's not total, that's all others, but 528 in Italy, 245 in Iran, 189 in Japan, the United States still 60. That's where we are as of today, 60. So this chart, as you can look on this map, you'll see these large red dots, mostly in China, a few outbreaks in Italy, particularly in Korea. You come to North America, and there's a tiny number of dots on there representing the 60. Now, that does not mean that that's all of the spread. That's 60 reported cases. There are 600 people, according to the Boston Globe, that are being monitored in Massachusetts alone. And I got a report about 100 in New York City. So we're looking for this carefully. Right now, there are 60 reported cases in the United States. So let's talk about that. No deaths in the U.S., 60 cases. We could just dismiss this and say no problem, but we can't. We absolutely can't. There's one case out of the 60 where we know that someone contracted this disease from a community spread. I'm going to read to you from a Breitbart story this morning. It says, the Center for Disease Control and Prevention confirmed Wednesday a potential case of infection with the novel coronavirus, COVID-19, in Northern California in a person not associated with a relevant travel history or exposure to another known infected patient. So that's where we have the concern. Once it gets out, and here's the problem, we don't know how contagious it is before you display symptoms. So before you get that cough or that feeling of general unwell and the sore throat or whatever, before you notice that, you might be a carrier. And that's how it could spread without us knowing. Boston Globe's monitoring 600 patients in Massachusetts. Another problem we have in the United States, there are limited numbers of testing kits and testing sites. This isn't something that you get at your local doctor or your local hospital. The Center for Disease Control has the kits. They're very good and they're testing, but they're not available every time you see a doctor. Oh, let's test to see if you have COVID-19. There are only a few places that we've tested. Now, the CDC, Center for Disease Control, estimates that a pandemic happens every 25 to 30 years. So if we had one now, and the last one was more than 30 years ago, if we had one now, it would not be unusual. It wouldn't be out of the norm. And I want you to remember this. When God's not giving you a spirit of fear, but power, love, and a sound mind, use your sound mind to understand that we've had pandemics before. We've survived them. The stock market survived them. People have lived through them. It's tragic for those who suffer in that pandemic. But for most of us, life goes on. And it will go on even if this turns into a pandemic. Johns Hopkins also says, and I think this is an important thing, and we've got a chart on this, Johns Hopkins says that our nation is the best prepared nation. The best prepared nation in the world. President Trump mentioned this in his news conference yesterday with Health and Human Services Secretary Alex Azar and Vice President Pence. The Center for Disease Control is at work. We are the best prepared. The President asked for $2.5 billion worth of funding to deal with this crisis, and the Congress said, maybe we should give you $8 billion. He said, bring it on. Whatever you give me, we'll use it to address the crisis. We trust the Congress. So if you look at the countries best prepared and worst prepared, China was ranked 51st prepared, North Korea 193, Somalia 194, Equatorial Guinea 195. But the U.S., number 1, the U.K. number 2, and Netherlands number 3. So we are as prepared as any nation in the world to deal with a pandemic of this sort. Now, if you can believe China, maybe the recovery so far have begun to overtake the number of new illness infections. And that's really good news if it's true. So let's look. Here's a chart. Coronavirus recoveries have overtaken new cases. We have new confirmed cases. There's this one massive spike where China changed the way they were reporting it, and then it came back and it's kind of bouncing along in the 2,500 or less category. But the number of patients who we declare recovered is now exceeding the number of new cases. That could be good news. There's 2 caveats. Remember, there is a potential for reinfection, and we'll talk about that in a little bit. There are 14 cases where people appeared to have been cleared of the disease and then later were tested and shown to be reinfected, or maybe the infection didn't clear entirely. And the second thing is the vast majority of these statistics come from China. I'm not sure that we can trust them. But if we can, there's potential really good news on the horizon, and it does appear that China is beginning to go back to work. Now, let's talk about the impact of the threat. We know the nature, let's talk about the impact of the threat. We've already seen a massive impact in the stock market. You know, the Dow Jones Industrial Average was flirting with 30,000. It was at new all-time highs just 10 days ago. Today, it dipped below 26,000 before it bounced. That is one massive decline in a very short period of time. In fact, it is the fastest decline from all-time highs in the history of measuring the stock market, to lose 10% that fast. Now, impacts will be felt in 4 areas that could affect you: the economic impact, the market impact, the health impact, and the political impact. And we'll talk about each of those. Let's start with the economic impact. China is ground zero. China is ground zero, meaning their economy has ground to a halt. Governments, the Chinese Communist Party had estimated that the Chinese economy would grow 6% in 2020, this year. Right now, the government is estimating it may be below 4% before this is all through. Now that's pretty bad. Keep in mind that they may be over-reporting those numbers, and if you listen to people like Gordon Chang, who we had on this program, they may be deeply in recession right now. Now, I need you to understand something else. There's $6 trillion of Chinese bank loans inside their country that would be at or near default if growth is less than 4%. And we don't take that from our statistics. That is from a Chinese central bank stress test. The People's Bank of China did a stress test on all their banks, and they found that if growth was less than 4%, it would put $6 trillion worth of loans at risk. The truth is the economy may be in recession, it could be negative, and this has an existential threat for the Chinese Communist Party. Now, I want to read to you from Zero Hedge. This is a report they put out earlier this month, and it says, China's banks face $6 trillion coronavirus cataclysm if epidemic is not contained soon. Here's a quote. In a little notice post back in November, we reported that as part of a stress test conducted by China's central bank in the first half of 2019, 30 medium and large-sized banks were tested. In the base case scenario, assuming GDP growth dropped to 5.3%, 9 out of 30 major banks failed and saw their capital adequacy ratios drop to 13.47% from 14.43%. Let me put that in translation to you in plain English. If their economy drops below 5.3%, 9 banks are in serious trouble. Then they said, in the worst case scenario, assuming GDP dropped to 4.15%, 2% below the official GDP print, more than half of China's banks, or 17 out of the 30 banks, failed the test. That means that even if you take the government's estimates and you believe that economic growth will be as high as 4% this year, more than half of their banks are teetering on the edge. Now, of course, China can jump in with stimulus. They can jump in and try and save these banks. But $6 trillion is an enormous amount of potential bad loans. Now, let me give you the economic impact of the threat. This is from Bloomberg on February 22nd. Despite accounting for 60% of the economy and 80% of the jobs in China, private businesses have long struggled to tap funding to help them expand during booms and survive crises. About 2/3 of the country's 80 million small businesses, including many mom and pop shops, lacked access to loans as of 2018. If China fails to contain the virus in the first quarter, I expect a vast number of small businesses would go under. That's a quote from the Bloomberg report. So this could have knock-on effects for China's economy for quite some time. But it's not just China. There are also supply chain impacts. Now keep in mind, over the past 2 decades, the Chinese have begged us to transfer our supply chains to them. They said, we'll lower your cost and we can get that to you efficiently. We'll improve the quality. They made all these promises, and so many American businesses did just that, so that we depend, when we make American products, we depend on Chinese parts and goods to be part of that. It's part of the just-in-time inventory, so we don't keep a lot of inventory on the shelf. Now, we've warned about this in our show. We've talked about it repeatedly in the economic war room. President Trump's trade war, fortunately, has actually helped prepare some businesses who have sought alternative suppliers outside of China, but it's still going to have an enormous impact. This is true for strategic materials, it's true for consumer goods, and it's particularly true for medicines, and we'll talk about that in a bit. This is why Apple issued an earnings warning just a couple of weeks ago that hit their stock and said, hey, if we can't get what we need from China, we won't sell as many iPhones and Apple TVs and computers as we were hoping. That hit Apple. It's also hit other major U.S. companies that depend on China. Now, I want to read another report from Bloomberg that happened last week. The virus is interrupting supply chains from watches to lobsters. Bloomberg. A Hong Kong watchmaker who can't get coils or wheels. New Zealand lobsters released back into the wild. A San Diego game studio facing delays to its latest fantasy board games. The coronavirus outbreak has hobbled China's economy, and it's increasingly ricocheting throughout the world economy and supply chains. Let me read it further. Here's another report, Wells Fargo. This is just a couple of days ago. News this weekend suggests that COVID-19 is starting to spread outside of China, with the number of confirmed cases in Japan and South Korea jumping. Although China claims the top spot as the most important country for American imports, more than $450 billion worth in 2019, the United States imported more than $140 billion worth of goods from Japan last year and nearly $80 billion from Korea. Together, these 3 countries account for more than 25% of total American imports last year. As we noted in a recent report, there could be supply chain implications for American businesses if Chinese factories shut down for any significant length of time, and similar considerations hold both for China or for Japan and Korea. In other words, American businesses dependent on China, Japan, and Korea may be hurting to get supplies. And if the coronavirus breaks out in a big way in those places, do you really want the supplies coming from there? That's something we've got to be concerned about, and something we've got to watch very closely when we start getting imports again, to make sure that the coronavirus is not spread on surfaces, that everything has been decontaminated properly. Now, let's talk more about the economic impact of the threat. The impact will be significant if infections spread in the U.S. It will be significant if infections spread in the U.S. Just think about it. Imagine if everyone stays home for several weeks. And the virus spread could last until June, and that's optimistic. Now in the summer, colds go down. And in the summer, people get outdoors, and so they're not in the closed-in spaces. They're not running the heating system all the time and so forth. But we've got to be cautious to make sure that we take care of ourselves and don't spread the impact. And when we do that, that caution will mean you don't go to theater as often potentially, you don't get on airplanes as often, schools are closed for a period, and that will have an impact. Also, reinfection rates are important. And we don't know what those really are yet. So this has a potential hurt on U.S. factories, retail, restaurants, travel, you name the business. At a minimum, this could knock 0.5% off the U.S. GDP this year. And it's already being knocked by Boeing having to stop production of the 737 MAX that they were producing. If we have a pandemic, it could be far worse. Now let's talk about this, because here's the bad news is that there's a risk to the economy. The good news is that typically in a pandemic you have what's known as a V-shaped recovery. It goes down very rapidly, but when economic activity comes back, it goes up very rapidly. And markets generally anticipate the V-shaped recovery, so they bounce down as much as they bounce off the top. Lost business will spring load for some industries. If you're going to buy a car in the spring, and you hesitate because you don't want to go out shopping, you'll certainly go out in the summer and maybe buy the same car. There will be home sales that pent up demand, just like we did coming out of World War II when people couldn't buy for a period and then they get to go out and spend money. But there will be other businesses that may just lose money. If you're a restaurant, you're not going to make up for it by seating twice as many people at dinner when people start going out to eat out again. All right, remember, pandemics do happen. They happen every 25 or 30 years on average. We recover, life goes on for the 98 to 99% of people who survive the pandemic. I don't want to minimize the tragedy, but I do want you to understand recovery is inevitable. And likely, we'll have the Federal Reserve stepping in and central banks stepping in with stimulus. We're already seeing lower interest rates, and this should help promote a V-shaped recovery. Now, let's talk about the market impact of the threat. Keep in mind, I'm not offering investment advice. You need to go to your own advisor to get advice, but I am going to share some thoughts with you. A few things to note. The market was at all-time highs just 10 days ago. The economy is solid, the market was rising, but corrections are normal. We should have a correction at least once a year and sometimes 2 or 3 times during a year. That's typical. We don't have them very often, haven't had them in quite a while. But we did just see the fastest drop from an all-time high in history. 10 days later, we're down 10%. That's the fastest drop from a peak to trough, at least since the 1929 peak. Bear markets also happen. They haven't happened in a long time. That would be a 20% decline, and we're almost halfway there in 1 week. And markets do recover after pandemics. They always have. It clears out the speculation. And so that is good. That's a good sign. You get the speculation cleared out, and it creates investment opportunities. Now, there are other things to be aware of. The move to index investing that we've gone through the past several years, and we've warned about in the economic war room, that when people own the index and they sell the index, it's indiscriminate. That means that you're not able to sell just those stocks that will be most impacted. You can't sell those that will have supply chain disruptions. You can't sell those that will lose customers from a pandemic. You can't buy those that will be winners, like telecommuting services that support quarantines or video streaming entertainment. You stay home and you watch a movie on Netflix or on Disney+. Those that do home delivery of food, you won't be able to address those. When you buy and sell index, you can't be discriminate. And I think that's a challenge for people. So it's a good time to check with your advisor. Find out how you're invested. Do you have a long-term approach? You know, based on your age, you may want to have a little more conservative portfolio or a little more aggressive if you're younger. Do you stick with an index approach? Maybe you do. Ask your advisor. Do you want to have more cash? Do you want to have some gold in your portfolio? We talked about gold in a recent episode with Frank Holmes. The title was Moral Democratic Capitalism, but you can go back and watch that. you need to look beyond the threat. Maybe to industries that might benefit from a reduced Chinese influence. Maybe there's a restart of manufacturing here in the United States. Maybe a supply chain rebirth right here at home. And so that might create some opportunities. Now let's talk about the health impact for you. Now, beyond the obvious of those who get sick, there are other health impacts. For example, we may run into limits on supplies of gowns and masks. I talked to one hospital where they had an 8-day supply of gowns and masks to do surgery. Now, what does that mean? If they only have 8 days supply, they're going to cancel elective surgeries, and they're going to focus only on emergency and absolutely necessary surgeries. These gowns and masks are manufactured in China, so it may be a while before we get them. Although I know the President and the White House are focused on finding alternative suppliers that they can get out as quickly as possible. That's good news. In fact, we helped take that message to the White House through some of our contacts. Now, there also may be a reduced willingness for people to seek treatment for non-coronavirus issues, and there may be a rise in telemedicine. So people will be going and calling the doctor rather than going out to the doctor's office. Now here's the big one, health impact. Pharmaceutical supplies that we have are dependent on China. Wow, wake up to it. I mean, people are saying, I can't believe that. We depend on China for some 90%, 80-90% of our active pharmaceutical ingredient, API, that we use to make drugs, common drugs, penicillins and antibiotics and heart drugs and so forth. You are way ahead of this curve if you've been watching the Economic War Room. Economic War Room, Episode 6 with Rosemary Gibson, we highlighted this, pointed it out, and then took it wherever we could to tell people. This aired in 2018. Let's roll a clip from that.
The United States is dramatically dependent on China for so many of our medicines. Antibiotics, chemotherapies, and so many other essential medicines. And this is an untold story. It's an economic issue, a public health disaster waiting to happen, and a profound national security issue.
Rosemary, why hasn't the mainstream media picked this up?
This is an untold story because there are very powerful forces that don't want the public to know. If we look at the major networks, their advertisements are funded by the pharmaceutical industry. The industry has done a lot of good for this country, but this is not a story that they want the public to know. And also, China has implicitly censored the U.S. media. It doesn't want to have bad stories about it come into the public mind, so they're off the radar. And so these are reasons that we aren't seeing this story out there in the mainstream media. And it's not a Democrat issue, it's not a Republican issue. This is an issue for all of us.
You should go back and watch this entire episode. It is so illuminating. Also, we prepared an economic battle plan for Episode 6. You can get that at economicwarroom.com. It'll give you action steps, things you ought to do if your medicines are made in China. Now I'm going to tell you what we did behind the scenes. We took Rosemary to all of our national security contacts, including Frank Gaffney and Fred Fleitz, who at the time, he's now the president and CEO of the Center for Security Policy. At the time, he was the chief of staff for the National Security Council. So we made the White House aware of this serious threat by introducing them to Rosemary. She wrote a fabulous book. Watch the episode, get her book, China RX. And we also helped take it to Peter Navarro. And I want to read to you what Peter Navarro said in a Fox News story a couple of days ago. It says, White House trade advisor Peter Navarro advocated for bringing home most of the U.S. pharmaceutical supply chain amid the coronavirus crisis in China. We've offshored far too much of our supply chain, not just for corona, but also for essential medicines we need, Navarro said on Sunday Morning Futures. Same reasons we offshored a lot of our other stuff, cheap labor environment, lax environment, and most of all, unfair trade practices. My part of the portfolio is to make sure our supply chains are secure and we have what we need. On the supply chain issue for the American people, they need to understand that in crises, we have no allies. So that's the good news. I know Peter. He's a good man working hard in the White House. I actually co-authored a book with Peter on China. So we're very pleased that they're working on this right now. But what this means is you might see potential critical shortages of medicines for a period. We need to make this a wake-up call. Never again should we allow this. This should be part of our domestic investment efforts to reestablish our domestic pharmaceutical industry. In other words, if you see an opportunity to invest in a company that's going to help rebuild the active pharmaceutical ingredient manufacturing here, that's something you should take a serious look at. It's something we're taking to our NSIC advisors, National Security Investment Consultant Institute advisors, nsic.org for more information. And if you don't have an NSIC advisor, you ought to look into getting one or ask your advisor to go take the NSIC courses. We'll be offering a new course later this year. Now that means aspirin, antibiotics, heart medicine, vitamins should all be made in the U.S. Our servicemen and women should not be put at risk, and neither should you. And so this is part of the important work by supporting the Economic War Room, part of the important work that you help us conduct behind the scenes to get ahead of the curve on this. Now, I also want to tell you there's a political impact. This could be the end of the CCP, the Chinese Communist Party, which wouldn't be a bad thing from my perspective. The Chinese people know that they've been lied to, the truth has been hidden from them, their government has not effectively dealt with this crisis, and if they've got biological laboratories leaking out dangerous diseases, whether in the form of animals or whatever, that is a threat to all of humanity. It also means that it's an absolute failure of the communist system. It is an absolute failure of the communist system. There are horror stories of civil rights violations, deaths, cover-ups, and atrocities. I don't want to go into those, but you can see them. You hear people taking their iPhones and they'll post things on YouTube, then they'll be taken down. There are atrocities that have taken place. We need to remember this. When you see socialism on the ballot, remember socialism leads to communism. That's what Lenin said. We need to recognize that this is not a good system. A free market system is the #1 best prepared system to deal with this kind of issue. That's according to Johns Hopkins. We don't want communism taking over our system. So that's a political impact if we wake up and see what's actually happened. I want you to watch episodes 11 and 12 of the Economic War Room. We titled that The 7 Deadly Sins of Socialism. 7 deadly sins of socialism. It always leads to human tragedy. The last century, 100 million people were killed by communism. Watch the episodes, read the battle plans. Now on the left, the progressive left wants to make this President Trump's Katrina. Already, they're saying, the president's not doing enough. The president's handling this poorly. I want to ask you a question. Who do you want handling this crisis? Look at the Democrat field and look at the Republican field and ask yourself that question. Who do you think is going to be decisive? Who do you think is going to do it protecting your freedoms? Who do you think is going to make the right decisions? That should be a voting issue. So the progressive left is right about that one thing. I'm not sure that I trust the progressive left in dealing with a health crisis like this. Now, I want you to watch out for media efforts to manipulate you with this information ahead of the election. I stayed here so I could get this information to you, but I was planning on meeting with Dr. Robert Epstein. He's the Google whistleblower. We covered him in episodes 20 and 21. He warns about Google and big tech controlling information to sway the election. Now, Dr. Epstein and I have become friends. I have great respect for his work. We spoke at Liberty University together. You need to look him up and see what he has to say about this. And you can look at our battle plan from episodes 20 and 21. Don't trust web results that start to get political if they go, because they could be slanted one direction or the other. And we'll put information on that in this battle plan, and we'll put information on how you can support Dr. Epstein's work in this battle plan. Now let's talk further about the political impact of this threat. This is going to expose those in this nation who've sold us out to China. And it may be painful, and it could hurt markets and companies and industries. There will be lots of companies forced to admit that they've been a part of the hollowing out of America. You know, there's a famous saying that you don't know who's not wearing a bathing suit until the tide goes out, and then you see people who are exposed. right now there will be companies who are clearly exposed by this serious problem. We've got to not ever let this happen again. And don't forget, Bernie Sanders, the leading candidate on the Democratic side, has an admiration for communism. You've seen the clips over and over. He admires Fidel Castro. He admires the Soviet Union. He even honeymooned there. He admires China and the way they handle things. And they say, get people out of poverty. I don't admire them for that because I don't admire the human atrocities that take place. This is really frightening. And we covered this, by the way, in a recent live episode where we had the Committee on the Present Danger, and we actually had a survivor of the Tiananmen Square massacre who was here talking about the horrible things that are happening inside of China 20 years ago and today. Now, what should we as a nation be doing? In the long run, we must rebuild American capabilities. And we talk about that all the time in the Economic War Room. That is not a new subject for us. So you ought to watch this show regularly so you can get updates on how we're making progress and where we're telling officials what we think they should be doing to help rebuild Americans' capacity. It also gives us an opportunity to reestablish critical industries, understand supply chains, but we should not bail out the Chinese Communist Party. We should help the Chinese people wherever possible. But the Communist Party has taken a huge misstep. We've bailed them out before. We should not bail them out now. And that comes from our friend Gordon Chang. They've destroyed our trust. In the short term, here are things that we should do as a nation. We need to have good hygiene practices. Maybe you don't shake hands with everyone you meet, or if you do, you get a wipe and wipe your hand quickly or use hand sanitizer. Be understanding. Let's be a little gracious and kind to people. And above all, do not panic. Panic will be more dangerous than the pandemic. So we need to not panic. 2 Timothy 1:7 says, God's not given us a spirit of fear, but power, love, and a sound mind. Now, health preparations. Remember, Johns Hopkins said we are still the best prepared nation in the world. That's good. Despite that, we have risks. So I'm going to read to you some advice from the Center for Disease Control website, cdc.gov. Consider where you travel. Consider limiting your travel. Stay home when you're ill. Cough in your sleeve, not on your hands. Don't shake hands. Frequently wash your hands and clean surfaces regularly with wipes, with bleach. The coronavirus apparently, and we don't know for certain, but apparently doesn't live long if you spray it down and wipe it up. It can kill it, and that's good news. Now let's read something from NPR. NPR says, what about face masks? And this is recent. It says, the science on whether it's helpful to wear a face mask out in public is really, really mixed. For starters, it depends on what kind of mask you're wearing and whether you're wearing it correctly. Some infectious disease experts are reluctant to recommend that people wear masks as a preventative measure because they can provide a false sense of security. I'll tell you what it is. If you have the masks, the typical ones that you could buy at Walgreens and they go around and they don't conform to your face, those are great if you're sick. Cough in those. Don't breathe outside of those, and that will cut down on the virus transmission. But if you're not sick, they're not going to protect you because any germs in the air can get around the mask and into you. So they're very helpful if you are sick, not so much. Now there are better masks, but most people don't know how to use them to conform them tightly to their face. And then what happens is they will touch the outside of the mask, taking it off, and then they'll touch their face and still transmit the disease. So you got to be very careful with masks. NPR says what experts do agree on is that wearing a mask is a good idea if you're sick so you can reduce the chance that you'll infect others, whether family members at home or people at the doctor's office if you go in to be seen. Pearl says that wearing a mask when sick is especially a good idea if you live with someone whose immune system is compromised or who's elderly, since people in their 60s and above seem to be the most vulnerable to COVID-19. Some research suggests that wearing a mask can help protect you if you're caring for a sick family member, but only if you wear it all the time in the presence of the sick person and if you're careful not to touch the front of it, which could be contaminated with pathogens. Now, what should you and your family do? If you got masks, get them out. There may be shortages. There are right and wrong ones. You need training if you're using the right ones. Keep that in mind. You need supplies. You need wipes. You need cleaning products. They should be bleach-type wipes and cleaning products. Stephen Morris says, professor of epidemiology at Columbia University, what we know from other coronaviruses is that most household cleansers, such as bleach wipes or alcohol, will kill them. So stock up on some of these things. Stock up on food, on medicines. You don't have to stock up for a year or more. You need an extra month's supply. And here's one of the suggestions my doctor gave me. Get an oximeter for telemedicine. You know, it tells you what your oxygen levels are. These aren't that expensive. You can get them at drugstores or Walgreens or Walmart or places like that, and it'll measure what your oxygen levels are. This is very helpful information if your doctor is diagnosing you over the phone. Now I'm going to read more from the NPR story. The reason to stock up on certain products now isn't so much to avoid potential shortages in the event of an outbreak, but to practice what experts call social distancing. Basically, if you want to avoid crowds to minimize your risk of catching the disease, if COVID-19 is spreading in your community, the last place you want to be is in line at the crowded drugstore or grocery store. If you take daily medications, for example, blood pressure pills, make sure you have enough to last a couple of weeks, suggests Katz, as long as you can get approval for an extended supply from your insurance provider. So you ought to stock up for a few weeks, 2 weeks to a month. The NPR story also said it's also worth buying fever reducers like acetaminophen or ibuprofen, says a pediatrician with Columbia University Medical Center. Think about adding enough non-perishable foods to your pantry to carry you through a couple of weeks, adds an infectious disease physician and a senior scholar at Johns Hopkins University Center for Health Security. They also suggest having on hand your go-to-sickbed foods like chicken or vegetable broth or crackers in case of an illness, as well as hydrating drinks such as Gatorade and Pedialyte for kids. Thus far, kids seem less vulnerable to COVID-19. That's because if you do get sick, you want to ride it through at home if you need to. So far, 80% of COVID-19 cases have been mild. Think cold or flu symptoms. Now, I looked at other places and I found a great list at Organic Prepper, a great list of items. I'm just going to highlight it, but I'm going to put in our battle plan a full list of this, what the Organic Prepper says. There'll be a link so you can go right to it. Imagine right this minute you have to stay home for a month. What would you need that you don't already have? You'll need food, water, medications, personal hygiene items, sanitation and cleaning supplies, pet supplies, special needs supplies for babies or elderly family members, and you'll need entertainment. So look at stocking up, not 6 months supply, but maybe 2 weeks to 4 weeks supply of these things. Now, what should you do for your family? Go back and watch episode 6 with China RX and Rosemary Gibson. Here's another great resource to look at, cdc.gov. cdc.gov, and when you're there, you can look /coronavirus/2019-NCOV-summary.html. We'll put that link in our battle plan. We'll give you in our battle plan a full situation summary, recommendation, and travel updates from CDC, a link to where you can get all that information from the CDC. Now, what should you do with your investments? And that's another big question. In the short term, the markets drop 10%. Do you raise cash or do you look for bargains? It really depends on your situation. You need a qualified advisor. We recommended the NSIC Institute, National Security Investment Consultant Institute, where advisors get trained to deal with these kinds of issues. You need to consider whether index investing is right for you or not. You need to consider whether gold is right for you or not. Episode 71 with Frank Holmes on moral democratic capitalism, we talked about the value gold might or might not have in your portfolio. Over the long term, you ought to look for ways to invest to rebuild American capacity. On the other side of this, there should be enormous opportunities. But I want to give you a warning, and this comes from the Securities Exchange Commission on February 4th, 2020. It says the SEC's Office of Investor Education and Advocacy is issuing this investor alert to warn investors about investment frauds involving claims that companies' products or services will be used to help stop the coronavirus outbreak. They said fraudsters often use the latest news developments to lure investors into scams. I'm going to put a link to this warning from the SEC in our battle plan. It concludes by saying, we urge investors to be wary of these promotions and to be aware of the substantial potential for fraud at this time. So if you read on a website, such and such has developed the latest vaccine, it's going to be available in the next month, you got to buy this stock now, be very wary. Make sure it's a reputable company, make sure they're not hyping the truth, and know the drug development process doesn't happen in days or weeks. It happens in years, potentially. Even if they speed this rapidly, and it sounds like they're doing it with one drug from one reputable company, it still could be many months before this is available to market. It might help in the fall or in next winter. Now, you also should rethink your Chinese investments. Remember, Chinese investments have no transparency, limited shareholder rights. They don't follow GAAP accounting, generally accepted accounting principles. We covered this with Kyle Bass. In fact, we covered it about the thrift savings plan, how our servicemen and women were investing in China without knowing it. So go back and review our episodes and battle plans, and we have a lot of these. If you've been watching our show, you have been warned about China in episode 23, 41, 43, 47, 52, 60, 65, and 69. And we'll put links to all of that in this episode's battle plan. We've covered this a lot. If you've been watching, you should have been prepared for issues with China. Now here's my conclusion. This is a challenge. It may be a crisis. But it's also an opportunity to rebuild America, to reset your family and your finances. EconomicWarRoom.com is where you can download this special episode battle plan. We will give you a summary, action steps, and links to articles. If you're watching live, it'll take me a day to get that up, but go to Economic War Room on Monday at the latest, and you'll find that battle plan. Go and check, and keep checking until you get it. It's important for you. And stay tuned to Economic War Room and Blaze TV. We are very well connected. When I tell you I'm talking to the top experts, I mean I'm talking to the top experts around the world on supply chains, on what's happening in Korea, on what's happening in the White House, on what the response is like in California. We've got our finger on the pulse of so many locations. You should stay connected to us. We are even called on for our expertise in some areas that I can't tell you about, but I've shared information with people, and you need to stay tuned because we will keep you informed. And I want you to pray. I want you to pray for health, pray for China, pray for Korea and Japan and Italy. Pray for God to stop this virus. Pray for people who are ill to recover. Pray for wisdom. Pray for blessing, and pray for the protection on your family. We need to get on our knees and ask God to protect this nation. And we need to remember, what we see as a marketplace, our enemies view as a battle space. Thank you for watching this special episode of the Economic War Room. This is Kevin Freeman from the Economic War Room.